It's Atch back with another health highlight from Michigan Primary Care Partners and Y102. When is the last time that you went through your medicine cabinet? It's probably been some time, hasn't it? And that whole term out of sight, out of mind really pertains to this. Because last time I went through my medications, I was like, oh, geez, I haven't seen this one in forever. I don't even know what this is. Then you start reading the label and you said, gosh, I haven't been on this in months or sometimes even years. So what do you do with that medication? How do you properly dispose of it? We're going to find that out. Plus, why it's very important to let your physician, your pharmacist know all of the medications and supplements, including over-the-counter medications that you're on, because there might be some very common adverse side effects when it comes to the interaction between over-the-counter stuff and the prescribed medications that you're on. So are expired medications okay to keep? That's something also that we're going to talk about, and we'll show you and tell you where you can properly dispose of any unused medication that you don't want anymore, or expired on this week's Health Highlight with Michigan Primary Care Partners and Y102.
I really think that patients should always make every pharmacist that they interact with and any physician that they see aware of all of the medications they're taking. There are so many different medications that have interactions that people are not aware of. For instance, there's a class of medications over the counter called NSAIDs. That would be your ibuprofen, your naproxen. That class of drugs can interact with blood thinners because they are in and of itself blood thinners as well. So for instance, if you were taking a blood thinner such as warfarin, Eliquis, and you were to take some of those over-the-counter medications because you had a headache, it could cause a harmful drug interaction that could lead to excessive bleeding. So a lot of times when you're on a medication, your doctor might take you off of one medication to put you on another medication. If that happens, there's really no reason for you to hang on to that discontinued medication. So there are many places that you can dispose of these medications. For instance, here in Big Rapids, our public safety downtown, you can dispose of unwanted medications. I would say that you should go through your medications on at least a monthly basis to make sure that you don't have stuff hanging around that you don't need. You may end up accidentally taking it, or it could expire, and then if you were to take it, while it probably wouldn't cause harm, it wouldn't do any good either. There are many drug interactions with over-the-counter supplements, and a lot of times people think because I can buy this over-the-counter, it's safe. While yes, that's true, it is safe, it may not be safe for you and the other medications you're taking. So it's always important to make your pharmacist aware of any over-the-counter supplements you might be taking.